Edu, who happens to be a senior colleague, distinguished ladies and gentlemen. It is a great honor to stand before you to deliver this lecture. But before I proceed, I would like to join Dr. Edu to thank our Executive Director for this wonderful initiative, because we have a lot of think tanks that specialize in politics, but few of them focus on the healthcare of the populace they are trying to do advocacy for. So I would like to thank our Executive Director so much for this great initiative and organizing this program for us to educate ourselves. Cannot share. So to start with, I would share my slide so that we would see what exactly the presentation looks like. The PowerPoint presentation is a perfect example that your sight is very important. And then those who came up with this idea knew that, you know, if you want people to absorb and then take whatever you are giving them, you need to give them something that they would see. So let's consider this PowerPoint presentation as an example that vision is very, very important. Dr. Edu has already told us something small about the Well Sight Day. I would just like to start by adding some information which would be very necessary for all of us in this discussion. Globally, it has been estimated that about 2.2 billion people have vision impairment, with at least 1 billion, that is almost half of the number, being cases that are preventable or can be avoided. So we have about 2.2 billion people who have visual impairment. Out of this number, half of them could have avoided this vision impairment. And this vision impairment poses an enormous global financial burden of over 244 billion US dollars annually. And all of you can bear with me that this amount of money is enough for a lot of the economies, especially in the developing world. So if we are able to tackle this problem of visual impairment, it could save us a lot of money. And like Dr. Edu rightly said, this Well Sight Day was, they came up with this Well Sight Day, and it was aimed at increasing awareness about eye health and avoidable blindness. So on this day, usually, as we sit here, it would not be coincidence that somewhere maybe in the US or in Europe, there are intellectuals gathered discussing on the ways through which they can use to avoid this preventable blindness. And it also serves as a platform to provide recommendations to governments and relevant stakeholders. So I would like to look at how important our sight is. Because if you understand how important your sight is, you will do everything it takes to protect your sight. Most research has shown that out of the 5 senses we have, the sense of vision is the dominant of all of them. And then research further estimates that about 70% of our perception, our learning, and activities that we do are mediated through vision. This is enough reason for us to love our eyes. And that is the theme for this year's World Celebration, Love Your Eyes. If you realize depends on your vision, you will do all it takes to love your sight. Now let's look at what glaucoma is. Because of the nature of the target audience, I have tried as much as possible not to make the presentation look so academic and technical. So I'll try as much as possible to break it so that the target audience will benefit from this presentation. Glaucoma refers to a group of eye diseases that damage the optic nerve, and it often leads to serious vision problems, including blindness. If you are wondering what the optic nerve is, if you look at the picture at the side, you would see something like a thread connecting the back of the eye to the brain. So when information from the environment gets into your eye, it is converted into what we call neural impulses, and they are now transmitted through that optic nerve, which is like a thread, if you look at the image, to the brain for interpretation. So if there's a problem with this thread, that is the optic nerve, definitely no information can be transmitted from the outside world to the brain for interpretation. And that is what glaucoma does. It attacks the nerve that transmits information from the environment to the brain for interpretation. And it is often referred as the silent thief of sight because it slowly damages the eyes and can cause irreparable harm before any vision loss is noticed. That is the problem with glaucoma, or in most of the glaucoma, because there are different types of glaucoma we'll talk about. Usually, the subjects or the patients, they don't notice anything wrong with their eyes until the vision is gone. So that is why it is called the silent thief of sight. It steals from you and then you don't know that it is stealing. Glaucoma is usually associated, but not always, with an increase in the intraocular pressure of your eyes. The intraocular pressure. The intraocular pressure basically is the pressure of the eyes. That is in layman terms. So glaucoma, or most of the glaucoma cases, they are associated with an increased IOP. But the interesting thing is that there are other types of glaucoma that do not have, or they do not come with an increased IOP. So if you take an instrument we use to measure the IOP, you would realize that the pressure is normal, but yet there is glaucoma. So those are the dynamics of glaucoma, and that is why we need to be very careful and pay serious attention to glaucoma. I want us to just briefly look at the types of glaucoma. There's what we call the primary open-angle glaucoma. And this is the commonest type of glaucoma in Ghana and in most parts of the world. Like I said earlier, it usually does not present with any early warning signs by the time the patient realizes the vision is gone. There's also what we call angle closure glaucoma. And in this type of glaucoma, there is, a problem with the drainage of fluid inside the eye. And when that happens, pressure builds up and it damages the optic nerve, which is the image you saw earlier. So that is angle closure glaucoma. There is also what we call normal tension glaucoma. And that one is a variant of the primary open angle glaucoma. That one, the tension or the pressure looks okay, but there is damage inside the eyes. There's also what we call congenital glaucoma. And then it is in congenital glaucoma, babies are born with problem in their eye that keeps fluid from draining normally. So the fluid is not drained normally and the pressure builds up and then it ends up damaging the optic nerve. And the important thing we have to note is that all these variants of glaucoma can cause blindness if not detected and managed early. We heard Dr. Edu tell us earlier that the key to preventing blindness due to glaucoma is early detection. So all these types of glaucoma, if they are not detected early, they can lead to damage of the optic nerve. And this damage, when done, is irreparable. It cannot be reversed. Let's look at some statistics, and then I don't know whether you find it scary or not, but I think it is very scary. According to the World Health Organization, glaucoma is the second leading cause of blindness globally, with over 6 million blindness. And it is next to cataracts. So cataract is regarded as the leading cause of blindness globally. Then glaucoma comes second. However, glaucoma presents as a greater public health concern than cataracts because blindness glaucoma causes is irreversible, unlike cataracts. For cataracts, if someone is blind due to cataracts, if an ophthalmologist does the surgery to remove the cataracts, the person can see, if only there is no other underlying condition again. But for glaucoma, if the damage is done, it is done. It cannot be reversed. So it is second on the list, but very, very serious than the one which is first on the list. And most studies consider Ghana as the country having the highest prevalence of glaucoma in Africa and second globally. This is what should be of concern to us. There's one study that was done. It shows that in Africa, Ghana has the highest prevalence of glaucoma. In Africa, we are number one. And globally, we are number two. And if you look at the study, there is one Caribbean island called St. Lucia. They found that in St. Lucia, that is where we have the highest prevalence of glaucoma based on the studies. So St. Lucia is one and Ghana is two. And you know, these academics, some of them try to play with this finding. And they said that perhaps those in St. Lucia, perhaps because they are in the Caribbean, perhaps they migrated from Ghana here. So it just tells us that we have to know that glaucoma is an issue of serious concern and we need to tackle it head on. Let's look at the statistics from Ghana here. In 2019, the Ministry of Health, that is the Ghana Ministry of Health, estimated that we had about 700,000 Ghanaians that live with glaucoma. And out of this 700,000, we had about 60,000 who got blind from the condition. And the ministry further estimated that by 2020, that is last year, about 900,000 Ghanaians will be living with glaucoma and more would have become blind from the disease. And these figures are just there to guide us. But we all know that in reality, these figures could be much higher because of how our system is. We don't usually get the opportunity to capture the full extent of some problems. So if you have a figure, usually a prevalence figure, which looks high, to be on the side of caution, you have to look at an upper figure so that you can prepare and then defend yourself. So glaucoma is an issue in Ghana, and then we need to be aware of that. So the question is, are there any warning signs? We already said that generally glaucoma does not present with any warning signs at all until severe irreparable vision damage is caused. However, the following symptoms are usually associated with some specific types of glaucoma. So like we said, there are different types of glaucoma. Some of them present with these symptoms. But the word of caution I would sound is that don't just see that maybe you have one of these symptoms and you conclude that maybe you have glaucoma. That is not the case. You would need to be examined. So for instance, blurred vision. Glaucoma presents with blurred vision, but it's not the only eye condition that presents with blurred vision. Also, there is what we call distorted vision, and there is total vision loss too. There's also severe headache. Some types of glaucoma, especially the angle closure glaucoma, can present with severe headache. But there are also other equally important eye conditions that present with severe headaches. There are some eye conditions that you need only the spectacles to save yourself from the throbbing headache that you have every day. And also eye pain. Some glaucomas present with eye pain. There's what we call halos around lights. Some glaucoma also present with these symptoms. But we need to be cautious. Like I said, it doesn't mean that you have glaucoma if you have these symptoms. Let's look at how some of these symptoms look like. If you look at the images that have been projected, you see one which is written normal vision. That is how everyone who doesn't have glaucoma or any underlying eye condition would see these two handsome kids in the picture. But anyone who has glaucoma, especially end-stage glaucoma, usually would have something we call a tunnel vision. Glaucoma starts by destroying the peripheral vision, what we call peripheral vision. And that is why most people don't notice it. As I stand to present this, I look straight ahead and I can see people seated there. But I can also perceive some objects around my right and then my left, even though I am looking straight. But usually that is not of serious concern because I can see people seated where my eyes are fixed. So what glaucoma does is that it eats up the vision from the sides until it closes up. Then the person now realizes that this is the problem. So this is what we call tunnel vision. It's very key in glaucoma. You only see the faces, but you don't see the sides. And this is very dangerous for people who want to drive. Because if you are driving, you should be able to perceive objects or drivers who are also driving with you. But glaucoma does not give you that chance at all. Also, if you look at one of the pictures, we have a halo of light. This is what a halo of light looks like. There's always a ring around any light you are looking at. But like I said, it is not specific to only glaucoma. There are other conditions that present with the halo of light. There's also what we call blurred vision, and you can see the image looks very blurred. In most cases, especially in the eye, blurred vision is usually caused by what we call refractive errors. And if you get the spectacles, you can see clearly. But there are several other conditions too that can present with blurred vision. Now let's look at who is at risk to get glaucoma. Who is at risk? Usually, the first thing we have to understand is that researchers are still trying to pinpoint what exactly causes glaucoma. There are several genetic studies that they are doing. So what we are now looking at is risk factors. Factors that can, predispose you to getting glaucoma. And you can see that number one on the list is race. If you are of African descent, you are more likely to have glaucoma. Almost all the researchers have shown that people of African descent are much more likely to get glaucoma than people of other races. That is why if you go to the US, for instance, glaucoma is very prevalent among the African Americans. That is where glaucoma is very prevalent. So if you're an African, you should know that you need to get yourself tested. You need to get yourself tested. Secondly, there's also genetics. If any member of your family has ever had glaucoma, you stand a chance, or there's an increased risk that you can suffer from glaucoma.
And so I know I've written a lot of things I want to tell you in the past, but I don't claim to know everything. I'm actually encouraged sort of a discussion approach. I don't mind finding out I'm wrong about something, except that I asked a little bit.
Knowledge 40 years and above, try to get your eyes tested. Also, there are some medications. I want to concentrate on eye drops that people use. They are called corticosteroids. And an example is prednisolone. Usually what most people do is that they just walk into a pharmacy and they buy some of these eye drops to use because they have some feeling that they like. So they go and buy these eye drops and then they use them. If you are a fan of using it, it could predispose you to having glaucoma if you use it for a very long time. So there are some people, when it just finishes, they go to rebuy, they go to buy, they go to buy, they go to refill. Even if a doctor has ever prescribed it once for them, when it finishes and they like the feeling, they take the bottle to the pharmacy to go and buy it. Prednisolone and then the other forms of corticosteroids can predispose you to getting glaucoma. Also, if you've ever had an eye injury or a surgery, it could predispose you to glaucoma. There are also other health conditions like diabetes. So most of these things are connected. You can't remove them. If someone has diabetes, one study showed that the person has about 36% chances of getting glaucoma. Aside the fact that diabetes, there's what we also call diabetic eye disease. There's also something like that. So if you have diabetes, you need to get yourself screened properly. You could have the diabetic eye disease, which is also called diabetic retinopathy, or it could predispose you to glaucoma. There's a mechanism which is very long and that is not suitable for this our presentation now. Also, hypertension can predispose someone or increase someone's risk of getting glaucoma. Also, there's a type of eye disease called hypertensive retinopathy. So hypertension predisposes you to hypertensive retinopathy, and then glaucoma itself. There's also what we call sickle cell anemia, and it also increases your risk of getting glaucoma. It doesn't mean you have glaucoma, but it increases your risk. And in sickle cell anemia, usually there is bleeding in the eye, and it contributes to a whole lot of factors. Now, the question is, how do I know if I have glaucoma or not? Dr. Edu told us earlier on that an important thing we should do is we get a comprehensive eye examination. And like I said, on WellSight, most eye care professionals try as much as possible to do a lot of eye screening programs for people. If you have not been able to do one, tomorrow or any other day, walk into any eye health center and then ask that you want to have your eyes examined. They will do it for you. And also, if you have ever done an eye examination, you have to try as much as possible to repeat it regularly. That is, annually, it's okay. If you try to repeat because you could go today and then nothing is worrying you. But the next moment after a year is so long, something could happen. So it's important that you try as much as possible to go. And the eye health professional, if you are thinking of what the person would do, the person would measure the pressure of your eyes and then examine your retina and possibly do a visual field test to see if you have started losing vision from the periphery already, because we mentioned earlier that glaucoma, it starts eating your vision from the periphery first. So the visual field test tries to pick up whether you have lost any vision at the periphery. There's a more advanced test that is able to pick early glaucoma, and that is the OCT. In Ghana, we also have them. So if you are able to go to your eye care professional and then they examine you, they'll be able to look at all these possibilities to better advise you on what to do. It is very important. So if I have been diagnosed of glaucoma, what is next? Is there a cure? Currently, there is no cure for glaucoma, but treatment is available. There are current studies, and then one finished last year that tried to look at gene therapy for glaucoma, and it looks like they have found some success. So a cure is different from treatment. Cure means that they'll be able to reverse what happened and completely stop it. But that is not possible in glaucoma because we said vision cannot be restored. So you can only be treated with various options that we'll look at later. But like I said, researchers are pumping huge sums of money to try as much as possible to see if they can cure glaucoma because of the burden it poses on the globe. Now, the treatment forms, there are a number of treatment forms. Those ones I would like to limit myself on is the use of eye drops. And then number 2 is surgery. So the doctor would examine you and then know exactly the mode of treatment that you should get. One thing we should know is that glaucoma is very expensive. And that is why preventing damage is very important. It is very expensive to manage glaucoma because there are some drops that are very costly. There is a common drop around we call timolol. That is what most of our locals here can afford. The studies have also shown that timolol these days, though it's effective, but it's not optimal in controlling the damage down to the optic nerve due to the increase of the pressure in the eyes. So there are more expensive drops. You can get a drop that costs about 200 cedis, or even more than 200 cedis. And you need to use it for every month. Every month, you pay 200 cedis or more to get a drop to use. So it is very important to preserve our sight. It is very important to take this, very important. Surgery can be done by ophthalmologists to also see if they can create some channels to consistently reduce the pressure. But even in that, sometimes after the surgery, they will still advise you to use the eye drops again in most cases. And also one thing about glaucoma is that when they are treating you, or if you get the drops, it requires serious patient compliance. They will tell you how to use the drops, and you need to be consistent. It's just like somebody who has BP, high blood pressure, and they give the person the drugs to take. You have to be consistent, otherwise the pressure might go off again. So in glaucoma, when you start, you consistently use it. If they tell you to use the drops twice in a day, morning, evening, like Timolol, then you do that. If it is once every day in the night, then you keep to that regime and then you use it consistently. Otherwise, if you fail, it becomes a problem. And one issue that we need to be very careful of or cautious of is that most patients who have glaucoma, they think that if they use the drops, the vision that they had lost already would come back. They have that misunderstanding. So when they start using the drops and they don't see any effect, then they tend to throw the drops away. Oh, this drop is not good. But usually they are not well educated that the drops would only prevent further damage, but it would not restore the vision that you have lost. So let's have that at the back of our mind. When you start, you're not expecting that the vision you lost would come back. You are only preventing further damage. So don't get tired. You have to consistently use the drops. And like you see here, poor compliance leads to continuous damage or continuous vision damage. Now, having said that, I know you have a lot of questions, and then my senior colleague is here, should help us to answer them. I would like us to look at some myths, because for every situation, there are people who misunderstand the situation. And if you misunderstand it, you are likely not to take it serious, or you are likely to do something overboard, and it will end up affecting you. So I want us to look at some myths, and I'm sure most of you have already heard of some of these things. The first one I want us to look at is, some people say glaucoma only affects the elderly, and that is not true. We saw earlier that glaucoma affects children, newborn babies, they can have glaucoma. The second is, if you have a 6/6 vision, if you have a 6/6 vision and no symptoms, you will not develop glaucoma. And then this is also a myth. For those of you who don't understand 6/6 vision, maybe in layman terms, it means perfect vision at distance when you are looking straight ahead. So someone can have 6/6 vision, but the person would have glaucoma. So the fact that you sit, if you had an eye test today, and then the doctor tells you that, oh, you scored 6/6 or 20/20, don't just conclude that you are safe from glaucoma. No, it could be that you have glaucoma. The doctor still has to look into your eye to see what is happening there. There's also another myth. Some say that I cannot develop glaucoma because no one in my family has glaucoma. This is also false. The fact that no one in your family has ever had glaucoma doesn't mean that you cannot get glaucoma. And in the first place, you might not even know whether the person has had glaucoma or not. You might not know. So it is very important. Don't just say that, oh, in my family, there's no blind person, or nobody has ever had glaucoma, so I am safe. No, you have to have your eyes checked. There's also another myth. Some say that someone diagnosed of glaucoma will definitely go blind, and this is not so. If you are diagnosed very early, and then the treatment is started, and you are very compliant, there is no way, hopefully, you would go blind. There is no way, hopefully, you would go blind. If only you are compliant. And if only there are no other conditions that come to complicate the situation, and I don't think you would go blind. The drops or any form of surgery you get would prevent further damage, but the vision you lost would not come back. So you need to have that at the back of your mind. Another myth is something that marijuana or hemp cures. There's actually a study that has been done in the US. And found that lowers pressure. But the study found that it was not for a long time. 2 or 3, then the pressure is up again. So it indeed lowers the pressure, but not for long. And the treatment of glaucoma wants that the whole day you have the pressure control, not only for 1 hour, 2 hours, or 3 hours. That is why you don't have to believe this myth. There's one food that is a delicacy, And then I have seen most people eating it now. It is called bitter cola. And then the locals call it mijunguru in Hausa, which means the cola nut for men. You see people abusing this particular cola. They eat it, some people eat it raw. Studies have found that it has some medicinal properties, that is true. But some people believe that it cures glaucoma. And sometimes if you see TV, if you watch TV, you see some people advertising that this, it can do that, it can do, over 1 million cures. So you need to be very careful. There's one study that was done in Nigeria. They found out that it was able to pressure of the eyes, but definitely it cannot be used to cure glaucoma. So if you are eating it, perhaps it has medicinal properties. I can't tell you not to chew it, but try as much as possible to seek the services of a professional. You go, they examine you, and then you get drops if you are if it need be. Don't think that if you are just chewing it, no eye disease can get you. Some even say that it can cure cataract. It can cure, and it's a lot. That is why I decided to add it here. And the picture is there for you to see. If you know it, that is what it is. It does not cure glaucoma at all. Eyes, very healthy. Is there something? The first one we want to look at is regular exercise. And exercise has been found to lower intraocular pressure. And exercise is already good. Everyone knows that exercise is good for your general health. So that is one important reason why we should always try as much as possible to do exercise. Cigarette smoking. This is also lifestyle. Some studies found smokers to have significantly increased risk of developing open-angle glaucoma, whereas some studies found no risk. However, smoking increases the risk of macular degeneration. So, like you see here, studies have shown that cigarette smoking can increase the pressure of the eyes, and this can result in glaucoma. But other studies found that there was no correlation. But granted, there's no even correlation between the two. Smoking predisposes you to what we call macular degeneration. So it is good to avoid it. There's a form of exercise which has also become popular, and that is yoga. Yoga is very good. There are so many studies that have shown how important yoga is. But there is one particular position, as shown in the picture. It is called the head down position. If you do it for prolonged periods, studies have found out that it could increase your risk of getting increased pressure in the eyes. So when you are doing some of these things, you just need to be cautious. It doesn't mean that you should stop them, but these are there to guide us, to serve as guide, and then precautionary measures for all of us. There's also another study that found that those who play high resistant wind instruments, such as the trumpet, those who usually blow the trumpet, if it is done for long periods, or if someone does it for several years, it increases the person's risk of getting damage due to glaucoma. Also, wearing tight neckties like I have done has been shown. Some studies have shown that it increases the pressure of the eyes. And if the pressure increases, it is likely to, cause damage due to glaucoma. So if you close from work, like if I leave here, you just go and then you take it off and then you are free. All these things are there to just make us be cautious, because we need to love our eyes. And if you realize that about 70% of your activities every day depends on your vision, you will do anything it takes that is reasonable to prevent it from going down. Some studies have also found that caffeine consumption, regularly had some slight increases in intraocular pressure, which can lead to glaucoma damage. That doesn't mean that you should stop taking coffee, but you have to be cautious. Then abusing it and then taking it over and over, it can lead to an increase in intraocular pressure. So what recommendations and then conclusions can we make from our presentation? We have all now realized how important it is to take good care of our eyes. It is very important to take very good care of our eyes. And then we have enumerated how you can do it. And the most important thing to start with is to get an eye exam. There are people who have never had an eye exam at all. There are people, and they are comfortable. So try as much as possible. The fact that you think that there's no pain, there is no blurred vision, you are okay, you have to revise your notes. There is one sad story I want to share. There's one lady, somewhere 2013, when I was doing my internship, there was this lady who used to come for glaucoma treatment at the facility I was in. And by the time she came, the vision had almost gone. By the time she came, the vision had almost gone. Recently, when I came back from my studies and saw her, she had a young girl, you know, pulling her around, leading her, and they were begging on the streets. It was very sad. A young girl, about 25 years, she lost her sight due to glaucoma. She was a trader or whatever job she was doing, it becomes difficult. If it is in the advanced countries, usually you can easily fit into the society. But here we are now coming up, it's difficult. So you need to try and then get your eyes examined as much as possible. Government has done a lot, and particularly this government has been at the forefront in supporting the healthcare industry. All of us saw the initiative that was launched a couple of months back, and that is the Agenda 111. It was going to provide hospitals for several communities across the country. Because if there's no hospital, where can someone go for an eye checkup? So providing hospitals to all these districts is a very huge step in the fight against preventable blindness. Because if there's a hospital facility there, you know, a local can just get up and walk there to screen the eyes. But if there's no health facility there, it becomes difficult. So we need to commend this government for this great initiative. Those who love their eyes should commend the government for this great initiative because they have opened up access. And by 2023, hopefully, these facilities will be open and running, and hopefully, eye care would be improved. Furthermore, I would like to recommend to government to try as much as possible to increase funding, especially in the universities, where the most eye care professionals, especially in the provision of equipment, and then in the enrollment, so that they can enroll more students to come and study. Our problems are so huge. There are communities in Ghana that we don't have eye care professionals. And thankfully, when the hospitals open up, definitely we would need numbers to fill those hospitals. So if enrollment is increased and then funding is increased for these tertiary institutions to train more eye professionals, it will go a long way to augment the efforts that government has done by establishing these health facilities. Secondly, we would also want to encourage the management of hospitals and eye clinics to encourage free eye screening programs. We can make way for free eye screening programs, especially those in the private sector. Let's try as much as possible. For the government sector, if you go with the health insurance, which fortunately was also has been, you know, revitalized by this government, and we commend the government for that. If you go to the government facilities with this health insurance, you are likely to get your eyes screened. But for the private facilities, it might be difficult. So we encourage these hospitals and eye clinics, especially for this period, to try as much as possible to open up for free screening. I have seen some eye clinics opening up for free eye screening from now until November. So I think it is very commendable. And if all other managers of other eye health facilities do that, it will be very good. And finally, people should make it a habit to have regular eye examinations. These facilities can be there, But if you don't have the commitment to examine your eyes, they will be lying there and then no patients will go. So we need to have that commitment. And the fact that you have had an eye examination before and they told you that you don't have any eye problem doesn't mean that you should stop. Regularly, every year, you go for a checkup and it will also be good for you. Importantly, those of us here or those listening, we are just few. Ghana is over 30 million people. And there are people who don't even know what glaucoma is. So if you have listened to this lecture, try as much as possible to educate other people. If you can pull someone to the clinic and tell the eye professional that I have brought this person for you to screen the person for glaucoma, you would have done a wonderful job. If you have kids, take them to the hospital to be screened. Some have the misconception that they have to wait for the kids to grow over 10 years before they can take them for an eye exam. No. Even a newborn, there is a way to test whether the newborn can see or not. So you need to take your children, the elderly, everyone. Let's all get involved. Let's all get involved to stop avoidable blindness like glaucoma. Thank you very much for your time. And I really appreciate the attention you have given me. Thank you so much.
Thank you very much, Dr. Issa. So at this point, can you let us see the chat to see if there's any comments, or can you open, unmute our participants for any questions?
May I ask a question?
Yes, please. Please go ahead.
All right. Thank you very much. My question is, how often should one be examining the eye within a year?
Thank you. Doctor, I think you can answer.
Yes. Okay. Good. So I think annually, if you can go once, it's okay. Usually we advise 6 months, but if you delay 1 year, it's okay. Once every year, it's okay. But if you have an eye condition, there are some that needs regular follow-up. Yes. There are some that need regular follow-up. So depending on the advice of your doctor, maybe come after 1 month for a follow-up. You have to go. You don't have to say you have to wait for 1 year. No. So you have to go by that. But if it's just a general eye examination and then there's no other problem, 6 months, 1 year, it's okay. Maybe my senior colleague has something to add.
Yes, I think that's usually we recommend yearly exams, right? So yearly exams takes care of screening for almost all the eye diseases that the doctor can go into the eyes, look at them and see what is happening. So for someone who has no issues, doesn't need any glasses, or even if you do, once a year, see your doctor, get that doctor's opinion whether you need to come back or not. In many cases, when patients are glaucoma patients, they will be on some kind of schedule. Once you are diagnosed, you are on eye drops. Typically every 3 months, your doctor will want to see you and evaluate what is going on. So usually it's a case by case basis, but if nothing is wrong and you are being a good love your eye patient, you should go every year and get your eyes examined.
Okay, thank you very much. And any other questions? Participants?
I have a question, please.
Yes, please go ahead.
Yeah, I'm called Mbogre Harun. I'm speaking from the villa.
Okay.
I want to first thank Doc for his wonderful presentation. I really enjoy it, and also thank the panelists there for your good job. My question is that I've been told that I'm glaucoma suspect more than 7 years now. And I've been waiting for them to confirm to me whether I'm actually a glaucoma patient or I don't have glaucoma. And all the time when I go to the clinic, it is that I'm glaucoma suspect. And it got to a point that I've used the eye drops and became fed up. So at one point, I was told that one will help me is this Timol, blue Timol. And that is what I've been using for the past 3 years. I use it every morning and evening. My question is there not something that, a test that will just clearly show whether I'm actually a glaucoma patient? And the second question is, are there no treatment from the disease called glaucoma? Thank you very much.
Okay, thank you.
You want to take that?
Yes, I think I'll take that. And thanks for your question. Thanks for, this is a perfect question to talk on early detection, right? So you see, he said, I've been called glaucoma suspect. And this patient, this gentleman is very lucky because what we are preaching here today, to go get your eyes examined, go get your eyes examined. He went in before the disease attacked him properly, right? So the day he went in 7 years ago, if he ignored the doctor and then 7 years has passed, he definitely would not be a suspect anymore. He would definitely be a glaucoma case 7 years later. So the whole thing about get your eyes checked early is to exemplify, this patient exemplifies exactly that. He went in at the point where they were only suspecting the disease. So what they have been able to do with the eye drop is stop further progression or further damage to happen. So they halted it, just like Dr. Issa was saying. When you go in and you are on the eye drops, you become fed up, you stop, that's when the damage will start. So I would like to tell the gentleman that the luckiest thing you can be in this eye care industry or as a patient is a glaucoma suspect instead of a glaucoma patient, right? So that means the eye drops are working and that it has stopped the disease from progressing. And that's a perfect testament as to why we are here about early detection. Yes.
Thank you very much.
So continue to use your eye drops. I would rather you stay a suspect than become a confirmed case. Your medication is working. Follow your doctor's advice.
All right. Thank you very much. Thank you.
You're welcome.
Okay. I think we have a question in the chat. One participant asked if is it hereditary? I think you spoke. Yes. You said something about
yes. We said that if you have family history, and family history means that if someone in your family has had glaucoma or has glaucoma, you have an increased risk of getting glaucoma. It doesn't mean that if your family member has glaucoma, you will definitely get glaucoma. No, there's an increased risk. And usually in our setting here, it's difficult to know whether your family member has glaucoma or not. One way we usually try to tease information from these patients is that we ask, has anybody in your family ever been blind? Okay, so if in your family, maybe you have someone who has ever been blind and you don't know of the cause, you should try as much as possible to get yourself examined.
Okay. I think the participant before also asked if it can be cured. He said something about
like I mentioned earlier that for now, there are studies and people are they are pumping huge sums of money into glaucoma research to see if they can cure it. And I said we need to make a distinction between cure and treatment. Cure means that you are completely stopping it and restoring, whatever had gone bad. Currently, there is nothing like that. There are clinical trials, serious ones. One was completed last year. They are still looking into it. So it is only treatment we have. That is why you have to take it serious. And when you start using the drops, continue. Don't stop at all.
And also, just because there is no cure doesn't mean that treatment doesn't work. I mean, glaucoma is an age-old problem. It has plagued this planet for quite some time. But sitting in 2021, the advances in the diagnostic equipment, in the treatment options that are available, surgical options that are available. It is as good as cure. Again, I'll go back to the gentleman who called. It is so perfect what he said. He, in a sense, he is living with the disease, but no more progression is happening. That means that the treatment options that he's on is working. I mean, an ounce of prevention is worth a pound of treatment. Exactly. So this is a prime example. Get your eyes checked and stop it early.
Thank you. Dr. Safaji, do you have anything to add?
I've got a question.
What I would say is that, like Dr. Issa said, glaucoma has to do with the nerve. I know nerves, when it gets damaged, you can't reverse it. That's why it's very difficult in curing it, but rather management. So far, the only thing is the management.
Okay, so back to the floor. Participants, please, any other questions?
My hand is up, Dr. Sibudaku.
Yes, please. You can go ahead.
Yeah, please. It's just to follow up on the gentleman's question. He said that he's been told, I like what he said, he's a glaucoma suspect, so like, but he has a tendency or he's a high, so he's not a patient yet, but it looks like he's been on medication for 7 years. Is it going to be forever? Especially when he's not a patient, he's not been declared 1 year. So why is he still on medication up to this time? So it looks like he may not get to the point where he becomes a patient, but then he's still on medication for all these years. Is there going to be a time that he stops? I just want some clarity on that. The two, he's the suspect.
Let me answer that, right?
In between the two.
When the doctor,
Okay.
when the doctor tells you that you are suspect or glaucoma suspect, it means that that doctor has seen 1 or 2 or 3 things. The way your nerve is looking, he's seen a little bit of damage starting, other risk factors, your health, all that combined. And he's saying that I suspect you have glaucoma. The doctor probably knows you have glaucoma, but because it is so early, he's saying I suspect. So in order not to get worse, let's stop it. And he's put a treatment regimen in place to make sure that you don't become that glaucoma patient. But in glaucoma, it's a slow progression over time. So today you are a suspect. If you don't get on the eye drops and stay on the eye drops, then that nerve will slowly increase in the damage that it gets. So at some point, even when you are just at the suspect stage, we need to step in and help prevent any progression from happening. So again, I'll go back to early detection. This gentleman is very lucky that he took himself in 7 years ago, 7 years before the nerve started damage, and his doctor has been aggressive. So he will remain a suspect for life. And
So he'll be on the drug for life?
Yes, he will be on the drugs for life, because in 7 years, there's no progression. If you take such a patient off the drugs, I can guarantee you almost that in 2-3 years, you will start seeing the nerve progressively. Yes, exactly. Yes, so I wish I can say, okay, here's a pill, take it, and then you take it once. But glaucoma is kind of like many other diseases. Is the body getting older, aging, progression of the disease will also progress if you don't do something to stop it. So it's like many diseases that we treat in the entire body. Once you get on medication like diabetes, high blood pressure, and all those things are contributing factors. So if you're still diabetic and your doctor is suspecting you're a glaucoma suspect, if the diabetes is not under control, if the high blood pressure is not under control, you will never also control the glaucoma. The trick is to stop it and stop the nerve from getting damaged.
Yeah, hello.
Thank you.
Yes.
Yeah, hello. I have a question.
Yes, please go ahead.
Yes, my name is Adam Mohammed Sani.
Yes.
Yes, I've been diagnosed with glaucoma for some years. Yes, I've been given treatment, Timolol. I've been given Timolol always whenever I go. But I travel from where I used to, the hospital that I used to go. So one of the nurses told me that whenever I'm away from them, I can go to the drugstore or pharmacy and buy the Timolol and use it. And secondly, my child, I've seen that some some tears sometimes in her eye. So I'm suspecting maybe that's some sign of the glaucoma. So what should he do? Should I take her to hospital, or it's not early for me to start the treatment? And the Timolol, is that the only drug for glaucoma, or there are other drugs that I can be using? And does it mean that if I'm using the Timolol, I'm going to use it for life? There's no time that I will say this time that I'll stop. I think that's my contribution.
So I think he has about 3 questions.
3 questions.
We'll take some.
So many questions.
Yes.
Don't worry.
So I think.
Sorry.
Oh, no, don't worry.
Yes, it's fine. Yes. So I think the first one talks about refilling the glaucoma drugs, which is Timolol. And I think if there's one drug that most practitioners advise for you to refill even without coming to them, it is the glaucoma drug, which is an example is the Timolol you are using. And that is because they don't want you to miss even for a day. So try as much as possible. If only you have, if it is true that you have been diagnosed, you try to use it. If it finishes, you go and refill before you get your doctor to check on you. And then your kid, you have to take the kid to be examined. Right? Yes, doctor about the whether there's any drug, and then also whether there are other drugs. You can
so as far as your child is concerned, like Dr. Isa said, we do exams on babies. So I would recommend you take your child into the eye doctor and get the eyes checked. It could be something else. If it's not glaucoma, tearing of the eyes suggests many things. So your eye doctor will go through a series of testing, look in the back of the eyes and around the eyes, and maybe give you proper diagnosis as far as your child is concerned. Timolol is actually a first line of defense drug, right? There are many different eye drops. There are surgeries that specialists can do. But Timolol is where we usually start, right? It helps control the pressure very well. It's not a new drug, it's been around for ages, and a lot of practitioners prefer to start there. But that is not the only option. What will determine whether you need to add another medication or go to a different level of treatment is if number one, the pressure of the eyes is being controlled or not. And also if your doctor, every 3 months, every 6 months that you go, that your doctor is still seeing changes or damage on the eye nerve, on the optic nerve. So if you go in 6 months later and your doctor tells you, well, the pressure is still too high, even though you're on Timolol, or with further testing, I'm seeing that there's more damage than I saw 6 months ago, then they will add a second line of medication, or maybe recommend that a specialist takes a look at some of the surgical options. But Timolol is definitely not the only eye drop. I mean, I can probably name 30 of them. There's not a shortage of medications to treat glaucoma. So speak to your doctor about when it will be appropriate to add a second medication, sometimes even a third medication. They have combination eye drops where Timolol will be mixed with another thing. Timolol will do its job. That second medication also has a different way of reducing the pressure. So you combine both actions and put it in one bottle. And then those combination drugs are also out there. But your doctor will determine if you are at the point where a second or third medication has to come in.
Thank you very much. I'll read one of the questions from the chat. Awudu, Kuma is saying that he missed certain parts of the lecture. I think he had connection problems, but he wants to know what are the causes of glaucoma, and do you think resorting to herbal or alternative medicine for glaucoma is good? Have there been any efforts in this direction?
So thank you very much for your question, and thank you for trying over and over to connect just to listen to what we have to say. The important thing is to know what glaucoma is and what predisposes you to glaucoma. We mentioned some of them because you are not around. Glaucoma, they are still struggling to identify exactly what causes it. But there are what we call risk factors, meaning if you have any of them, it is very likely that you will have glaucoma. And we began by saying that the first on the list is if you are of African descent, if you're an African, or if your lineage has some African blood, you have a high risk of getting glaucoma. Also, if in your family you have a relative who has ever had glaucoma, it means that you have a high risk of getting glaucoma. But it doesn't always mean that you have glaucoma. If you are also over 40 years of age, you have a high risk of getting glaucoma. And there are other risk factors. And these are the three, I think, most important ones I would like to state at this moment. And what else?
And then he also wanted to know about the herbal.
Yes.
As an alternative. Is that resorting to herbal medicine? Is it an alternative?
Yes, herbal medicine for the eyes is a different topic on its own. Because if you talk to practitioners at the hospitals and at the clinics, you would realize that most of the damage done to the eyes is because of these herbal preparations. Yes. So you have to stay away from them because you don't know the content. In the eye, there are certain structures, especially what we call the cornea. If you look into the eyes of your colleague, you see a black, if the person is of African descent, you see something black. The clear covering on that is called the cornea. It is very sensitive, and most people have damaged it by using herbal medications. And if that is damaged, even if the sore, it will create a sore, what we call an ulcer. And even if the ulcer is healed, it will leave a scar. Every sore leaves a scar. And when it leaves the scar, it might be difficult for the person to see, depending on where the scar is. So you need to stay away from these herbal preparations.
I think what I would like to add to herbal medications is that it hasn't been studied on any deeper level. So the medical practitioners like us, our understanding of herbal mixtures and medications that you can directly put in your eye is very, very limited. We don't have studies on that. But with that said, the eyes are very sensitive. Most medications that you put in your eye that you get from the pharmacy, all of them have some type of preservative in it, right? The preservative means that it can stay on your shelf for a period of time without germs building up. So even if you take that subject of preservatives alone, when you are about to use herbal medicine, number one, we don't know how much dosing is enough and how much is too much and how much is too little. So going to even recommend it, we have limited knowledge. But more importantly, the eyes is one place that you don't want to introduce germs into. In your effort to try to solve one problem of glaucoma, you put eye drops that is not preserved, that is just straight out of a mixture filled with bacteria. It gets in your eye, and like Dr. Issa said, ulcer, and now glaucoma, that the ulcer can also destroy your vision. And ulcers can destroy vision in 10 days, as opposed to glaucoma can slowly deteriorate over years, right? So the lucky thing about glaucoma is that you have so many chances to stop it. If you get bacteria in your eye, sometimes within 3 days, your vision is compromised and the ulcer has got to a point where now you can't see at all. So in that sense, I would say see your eye doctor and make sure that you regularly check your eyes and get your information from them.
Okay, wonderful. So I think at this point, we'll go back to participants. Do you have any further
question?
Okay, please go ahead.
I want to know at what point in your pressure are you considered a glaucoma patient? And then also, if there is a way to stop, could it get to the point at which your doctor could tell you not to take it again, but you're good?
Okay, Dr. Issa.
Yes. I think Dr. Edu answered a similar question earlier, but I would want to buttress this point. There's a huge dilemma as to when to start glaucoma treatment. So Dr. Edu took the progressive approach. If the person is a suspect, it's better because these drugs have not been proven to have any damage or any harm. So it's better to save by using the drugs, and that is a more reasonable approach. So even if you are a glaucoma suspect, like Dr. Edu mentioned earlier, if the doctor tells you to use the drops, use it. It is good because I don't think these drops, there are studies that have shown that they are very harmful. I don't think so. So it is very progressive and it's very reasonable to do that. If they say you are a suspect, but use this to preserve the sight, you use it. And if only you are a suspect or confirmed glaucoma patient, I doubt there is a day your doctor will boldly tell you to stop using the medication. You don't have to dream about that day. Yes. The important dream you should have is to be able to use the drops consistently. That should be your dream. Yes, you should be able to use the drops consistently.
I think what I would like to add to that, I think his question was specifically at what point does a doctor tell you that you have glaucoma, right? So I'll tackle that first. You know, with everything in the body, all diseases, there are parameters and guidelines, there's information we collect, and then we look at it holistically and say, okay, this person definitely has glaucoma. So in glaucoma, we look at several factors. What is your eye pressure? Just like blood pressure, you go to your doctor and the nurse will take the blood pressure and say you are 110/80. And the doctor is like, great, go home, you're fine. The same standard also apply to eye pressure. We have numbers that the range of pressure should stay within. So between, let's say numbers 10 to all the way to about 18, 19, 20, your doctor can comfortably say, you know, if your pressure is this low, I'm not worried about it, I'll just monitor you. But I'll say most practitioners, if your eye pressure is consistently in the 20s, every time they measure, they get 20 something. Every time they measure, they get 30 something. They will jot that down like, okay, this is not in the normal ranges. So that's one thing, pressure in the eye. Then your doctor will go further and look at the optic nerve itself and see with all the technology that we have available now, with the instruments, the scopes that we have, we as doctors, we can actually look at the surface of the optic nerve and see whether there is damage that has happened to them. So some doctors will take the approach, okay, if I see that any damage whatsoever is starting to show on the optic nerve, I immediately go to treatment. I am of that school of thought because as eye doctors, we know that glaucoma is progressive. We also know that once you lose a nerve, you cannot catch it back. So there is no benefit in waiting to see more nerve damage before you interfere with it, right? So there are some patients where I'll look in the eye and I'll tell you, you don't have glaucoma. That we can do because the pressure is stable and normal and low. And when I look on the optic nerve, that optic nerve is full of nerves and none of it is damaged. And I can tell you, go home. That we can do. But once we start seeing damage, sometimes we don't know, have you only lost 3 nerves or have you lost 50 nerve fibers? And so that can be tricky. Some doctors would say, if I even see somebody has lost maybe just 2 or 3 bundles of nerves, I will treat that person. Some people will wait till you've lost 50% of your nerves before they start treatment. I like the aggressive way of dealing with glaucoma because after 20 years of practice, I know where it's going to go. And so if those 2-3 signs are there, it's definitely a glaucoma case and we should be treated.
Thank you. Do you have any more questions? Otherwise, I'll
Yes,
do
please.
a couple of. Go ahead.
Good evening to you all, and then I would like to thank Dr. Issa for his wonderful presentation, and also to the panelists. I say thank you for moderating the presentation or the program as well. Okay, so my question is that should a diabetic patient be worried about glaucoma? Thank you.
Please repeat your question. Should a diabetic patient?
Yes, my question is, should a diabetic patient be worried about glaucoma?
I think you made it.
Yes, the diabetic patient should be worried because studies have found that someone who is diabetic is at risk or he has an increased risk of getting glaucoma. So a diabetic patient should try as much as possible to get the eyes examined. And we also added that aside the risk of glaucoma, there's what we call diabetic eye disease, which a diabetic patient can have. That one can also have serious, consequences to the eye. So it's important that a diabetes patient, usually if you go to the hospital and the medical practitioner knows you have diabetes, he or she would advise you to go for what we call a dilated eye examination. It is routine. If you have diabetes, they would ask you to go for a dilated eye examination to make sure that the eyes are fine. So anyway, you have to get your eyes examined.
Okay, there are 3 questions in the chat. I think our time is almost done, so I'll put all 3 together and you can answer them. So there's someone who is asking, please, I want to find out those who wear contact lenses, is it easier for them to get glaucoma? And please, wearing normal shades, that I mean sunglasses, the person obviously needs, does it have a long-time effect on the eye? And then finally, I heard smoking marijuana weed cures glaucoma. I wanted to find out.
Okay. So I think Dr. Issa tackled the marijuana, so I'll leave that one.
I also heard.
Yeah, and then I think the first one is about
those who wear contact lenses.
Okay, so
you at risk.
Yeah. No, that's the short answer to that. Contact lenses has not been found to be directly linked to causing glaucoma. Wearing contact lenses have many issues that can come up with it, especially if you're not taking care of them properly, you're not washing your hands. As I said, the eye is very sensitive, so getting any bacteria into your eye can cause a whole host of issues, but definitely not glaucoma. It is not connected to that. That's the short answer. But take care of your contacts. Make sure that you throw them away as your doctor has recommended. Make sure that you clean your cases, you wash your hands before you handle any contact lenses into the eye so that you don't get bacterial infections in the eye. As far as wearing shades, of course, I recommend for everybody, everyone to have UV protection in your glasses, even when you don't need prescription. Normal sunglasses that is from your doctor's office. I'm not sure about the ones that they sell on the street because I can't tell if it's actually UV coded or not. But your regular eye doctor's office, you should be able to get sunglasses that have UV protection in it. UV comes from the rays of the sun. This is a tropical place. We are right under the sun all day, every day. And damage from the sun to the eye, it can be quite harsh. The sun can be quite harsh on the eye. So I recommend sunglasses that are not prescription. Even if it's not prescription, I recommend sunglasses that are UV protected. I'm not sure if I can quote any direct studies that linked shades to specifically to glaucoma, but there are many studies that have shown that wearing sun protection, sunglasses with UV in it, prevents a lot of cornea diseases that, or even in the back of the eyes on the retina, we can prevent you from getting some of those.
Thank you very much. And thank you very much to our participants for today's lecture as well. Our time is far gone. It's 7, and we were ending this program at 7. So we will ask Dr. Agnes, even though she's done a lot of talking and helped us answer a lot of these questions, to still give us closing remarks, something about how all of this has gone, and then general advice to our participants for today. Please. Yes. Please go ahead, Dr.
Okay. So once again, let me take this opportunity to wish everybody a happy World Sight Day. That's the reason we have gathered here today. My advice to you is get your eyes checked today, or it's late, tomorrow, get your eyes checked and check it regularly every year. Let me say a few thank yous, first of all, to the general public, to those of us who joined us today, taking time out of your busy schedule to join us this evening. Thank you for coming. I would also like to thank the board chairman, the board members, and the past and present directors of the Danko Institute for all the support that you've given to this important topic this evening. Dr. Imoro and Dr. Asafo-Jay, my colleagues. They say I'm the senior colleague, but you know, girls, they don't want to be called senior. So. But I appreciate you coming and impacting all this wisdom in the room. And I hope that people will take the information that they received here today and help better their sight. So Dr. Asafo-Jay and Dr. Imoro, thank you. Dr. Annie, I don't know where to start. You have been the rock for this program. And I walked into DI today and I said, there's a lady in charge of it. Amen. If what I see here is an indication of what's to come for DI, then I know with your leadership, this DI is going to enter its most dynamic phase from here on. So thank you so much for putting this program together. Our next advocacy program here at DI will be on breast cancer. As we all know, October is usually Breast Cancer Awareness Month. So a time and date will be communicated in due time from the Danko Institute. Once again, thanks everybody for coming and joining us this evening. And we hope that this night has been informative, and happy World Sight Day to everyone. Thank you.
Thank you all very much.
Thank you.
That was very. I knew this would get questions. Yeah. There's a lot of questions that are very interactive. I like it. Very nice. I really appreciate it. It's so.